Causes of feline behavioral problems and helpful remedies. Cats are popular pets because of their mysterious and free spirit. These mysterious animals, however, can occasionally exhibit worrying behavioral disorders. The health and happiness of our feline friends depends on our ability to diagnose and treat the underlying causes of these conditions. In this video, we'll delve into the most common causes of behavioral problems in cats and talk about solutions that actually work. Aspects of the natural world. Poor living conditions are a major contributor to cat behavioral problems. Cats, as highly sensitive creatures, need a home that provides them with a sense of security, stimulation, and comfort. Stress, anxiety, and behavioral issues can result from factors like a lack of vertical territory, inadequate hiding spaces, a lack of litter boxes, and a lack of available floor space. Changes in living conditions, whether they be a move to a new house or the adoption of a new pet, can also precipitate behavioral issues. Make your home more cat-friendly by installing scratching posts, hiding places, extra litter boxes, and vertical cat furniture like cat trees and shelves. Introducing novel things or animals gradually can help reduce anxiety. Instilling regular habits and providing a serene, predictable environment will also help your cat feel safe. Mood and personality. Even though they have their own minds, cats are very attached to their human families and, in some cases, other pets. Cats can develop behavioral problems if they aren't socialized enough, especially during their formative years. These can show up as hostile behavior, irritability, or silence. Resolving social and emotional problems can be aided by engaging in positive reinforcement and stimulating activities on a regular basis, such as interactive play. Spend quality time with your cat by playing with him or her, petting him, and solving puzzles to keep his mind active. Cats make great pets, and studies have shown that having one around can improve people's social skills. Challenges in healthcare. Cats' abnormal behaviors may have medical causes as well. Behavioral modifications may be the result of illness, injury, or the effects of aging on the body. When cats are in pain, they may become hostile, avoid using the litter box, groom themselves excessively, or withdraw. The solution is to take your cat to the vet if you notice any drastic changes in its behavior. It is crucial to have regular checkups and get any health issues promptly treated. If your cat is acting abnormally, veterinary care may be able to help him or her return to normal. Extremely upsetting events. Traumatic experiences can have an effect on cats, just as they can on humans. Traumatic experiences, such as abuse or neglect, can have long-lasting effects on a person's personality and actions. Traumatized cats can exhibit behaviors like hostility, aggression, or avoidance. Cats who have been through trauma need to be cared for in a secure and loving setting. Helping them trust you again requires patience, understanding, and gentle handling. The benefits of consulting an animal behaviorist or trainer with experience in dealing with traumatized animals. Establishing a consistent routine and using positive reinforcement techniques cannot be overstated. The health of cats depends on our ability to identify and treat the underlying causes of their behavioral problems. Owners can effectively mitigate and repair these problems by addressing environmental, social, emotional, and health factors. Treating behavioral problems in cats requires patience, consistency, and compassion. Always consult your veterinarian or an animal behaviorist for advice when dealing with severe or pervasive behavioral issues. If we give our feline friends the best of care, they can live happy, healthy lives with us.